In the city of Baltimore, 94% of residents there have some form of health insurance, yet many face alarming disparities, including higher rates of chronic diseases and shorter lifespans. As special correspondent Christopher Booker reports, one program is trying to overcome barriers by providing health care straight to people's doorsteps.
Hey, sweetie. You want your blood pressure checked today?
Tuesday mornings are busy in Johnston Square Apartments in East Baltimore.
Well, hi, Miss Kiana.
Set up in the lobby, nurses offer free basic checkups for anyone who may be passing through.
Nice and relaxed, okay?
71-year-old Laverne Clark has lived here for 6 years, and these weekly nurse visits have become part of her routine.
Make sure my heart rate is good. It really helped me a lot with all my medications.
Nurses say many in this predominantly black neighborhood face barriers to health care. There is a shortage of primary health care doctors, and transportation to providers can be difficult.
This community is insured, but if you ask them when's the last time you've seen your provider or do you have the medications that you need, that's where things fall apart.
Tiffany Reiser is a nurse practitioner and part of this pilot project that organizers call Neighborhood Nursing. Launched in January, the aim is to bring healthcare to communities block by block.
If you remember back in the good old days, doctors used to make house calls quite regularly, and now that's quite a rare thing. And that disconnect, I think, is what led to our healthcare system forgetting that this is where people spend most of their time. When you see them in their home, you really get an in-depth understanding of the challenges that they're facing.
As he broke it down by needs, then broke it down by insurance.
The team consists of nurses and a community healthcare worker who helps residents work through any problems they have accessing healthcare.
I lost the wallet, really.
Oh, what was in your wallet?
All of my identification, all my important papers.
79-year-old Andrew Hampton hadn't seen a primary care physician in years, partly because he didn't have any identification. The team helped him replace his ID and recently scheduled an appointment with a doctor.
We're hoping that with this recent visit, we're able to get him plugged into the care that he already is covered for and has paid into. Just a matter of getting it to his front door.
America spends more per capita on healthcare than any other high-income country. Yet we have the lowest life expectancy at birth, the highest rates of death for treatable or avoidable conditions, and the highest rates of infant and maternal mortality.
Experts say making preventative primary care more accessible through programs like this one in Baltimore could make a difference.
If we can do it universally, where everyone gets it, where it's like a right, like a utility, then we'll be able to reach the promise of preventive care that is not just reactive and that we're preventing things for everyone, and everyone could be at their greatest health.
Sarah Zanton is the dean of the Johns Hopkins School of Nursing and leads the philanthropy-funded program, a collaboration with the University of Maryland, Morgan State, and Coppin State Schools of Nursing. She says by next year, they plan to bring primary health care to more than 4,000 Baltimore residents, regardless of their insurance coverage.
The vision is that we will go door to door and be in the laundromats, in the libraries, in the schools, sort of blanketed so that everyone has access to a nurse and a community health worker.
The approach was inspired by a public health program developed more than 1,000 miles away in Costa Rica, where healthcare workers aim to visit every resident nationwide in their home at least once a year.
They might come back to visit them if they have high needs. They might connect them with other parts of the public health or nutrition system. And all the time, they connect them with the acute and chronic care that that person might need.
Harvard School of Public Health's Dr. Asaf Bitan has studied the impact of Costa Rica's model.
Costa Rica has significantly improved the health of its population across both what we call communicable diseases. Those are infectious diseases that can often be prevented with vaccines and other antibiotics, as well as non-communicable diseases.
Costa Rica has achieved those better health outcomes while spending less than a tenth of what the U.S. spends per person on health care.
We tend to focus on people who are sick as opposed to focusing on keeping people well or identifying problems early to help avoid more serious problems later on.
Melinda Abrams is the Executive Vice President for Programs at the Commonwealth Fund, a healthcare research organization. She says the complicated nature of healthcare in the United States would make it difficult to expand a program like neighborhood nursing beyond Baltimore.
The major barrier right now, in my opinion, is the financing. We tend to focus on hospitalizations and specialty. We're really focused on individual services, which incentivizes more volume, as opposed to having clinicians be accountable for both the quality and outcomes for patient and patient care.
Back at Johnston Square Apartments, this new approach has started to see small wins. Calls to 911 from the building are down. And organizers say the community has started to take the effort beyond the weekly checkups.
I went to a meeting where it was shared with me that people in my zip code, this area, our life expectancy is not as long as in other areas. And that bothered me.
Left arm reaches up.
Longtime resident Regina Hammond suggested the nurses help create a neighborhood exercise group. They now take weekly walks, and on days when it's too hot, they work out indoors.
Why was there a need for a walking group?
Because a lot of people don't venture too far because they don't want to walk alone. Some people don't feel safe. It's about getting out. It's about learning who's in your neighborhood. It's about looking at beautiful flowers, being able to talk with a nurse walking beside you, talking to them about things that nobody took the time to listen to you about. So it's serving a lot of purposes.
She hopes to see this initiative grow beyond her neighborhood. That, Abrams says, is possible, but will require collaboration.
What it would take is federal policymakers, state policymakers, the hospitals, the doctors, and the insurance companies to come together to agree to pivot and invest more on prevention and primary care. No mistake, that is very hard to do. But I'm optimistic because there are a number of communities that are experimenting with this right now.
It was 115/70.
But for now, in this community, these nurses will keep showing up week after week. For the PBS NewsHour, I'm Christopher Booker in Baltimore.